Good morning, everyone. It is probably 9 o'clock a.m. something in the morning. Thought I'd do a video since I haven't done one in a few days. Well, 2 days, 1 or 2 days. Anyway, yesterday and the day before, tried to recover as far as what exactly I've been up to. This will be my video diary, I believe, 7. Yesterday I saw my therapist, Sally, and we went over some things, like a list, like, for example, do I feel, try to think of one, so just give me a minute here. I have to pause and so I can think for a second and then get back to you on that for just 1 second. Okay, one I could think of, but it's like a list of things. I wish I could have got a copy. Yesterday, it was Friday. One of them was, I think, said something about, do I feel weak? And then the other one would say, do I feel ugly? I feel ugly. I felt, what was it? Do I think my body's ugly? What else? Can I be trusted? Do I feel like I have options? I think, I don't remember all of them, but it was just like a list of things. That was on a piece of paper, and she'd take notes and stuff. And before that, my husband and I just kind of had a little dispute of my mom and my dad, staying here and things, and before heading to Sally's, so I was a bit upset and agitated because he was asking me, okay, I don't have anybody else to talk to, and things like that, and I was like, well, I really can't handle it, and I really don't want to hear it because I don't really have a solution or answer that he's wanting. They're just asking if I had like a solution to solve a problem or something between mom and him. Sometimes they don't get along all the time. Anyway, I invited him to one of my sessions, therapy counseling sessions with Sally, and it wound up being my advice to him was, and I think Sally agreed, it'd be best if you had like the one-on-one, try to work it out, discussion, then walking around the room, sit next to her, eye contact with each other, that sort of thing, things like that. Other than that, the session, I think it went well. Then after that, I went and saw my psychiatrist, Dr. Wadood. He seemed a bit distracted today, and he seemed like it felt like a little bit of a repeat, like with Nancy Wilkerson, where they ask you something that they've already asked you, I think, before. Maybe he sees a lot of people, maybe it's that. And he's a busy man. He goes to hospitals, and he goes to outpatient at Sharon Mission Medical Center, outpatient group therapy, and he is a psychiatrist there too, and he does other things. I'm not sure what else, so maybe it's that. But other than that, he thinks I'm doing well. He increased my mirtazapine to 45 milligrams, and I think he's trying to get me off of my clozapam, which is 1 milligram, which I was taking 3 times a day. He suggests to take one in the morning and afternoon, and in the evening if I have to, instead of around 10, take one like in the evening if I have to. I think he wants to slowly get me off that. He didn't say anything about me not continuing with the sleep medicine. I can't really pronounce it. Maybe I'll show you about the bottle next time. I'm not sure if I have already. I asked how I was feeling, am I feeling any better, and told them there's times where I'm by myself and I feel anxious, or when I'm alone with my daughter, or when I'm alone, feel anxiety, a little bit, and sometimes a little more. It just varies, I guess. I'm not really sure how to quite explain it. Like going into a place by myself, like when I went to Target to get my shoes, and I was undecisive on which shoes I wanted to get, and then I just was looking around, I don't know what it was, just felt like anxiety coming on. Anyway, so yesterday, I asked him about the finger pain and the bones. Maybe the signs of starting with arthritis. I don't know. This is the first time I ever felt it. It started about a week or two ago, about 2 weeks ago, and it's still going on. My upper knuckles, don't hurt or anything. It's just here in these bone areas and the lower bone, in between, and on top. When I bend or make a fist, and it's on both hands, and I really didn't get a clear answer from him. Besides, he asked me if it's because I've gained weight, and I'm like, no. My weight's fluctuated before, but I've always been able to get my ring off my finger. I can on my right hand, it's just on my left. If I want to take my wedding band off, I can't. Anyway, I think, I'm not sure how much he was actually paying attention. He seemed kind of quiet this time. He didn't really seem like he was asking very many questions like he was the first time. Ariel Heath, my case manager, was there, and so was Robert. I learned later that my mom wanted me to pick her up later when it came to Dr. Wadou's appointment, and I forgot and didn't even catch that or remember her saying that, but she said she would have gone, and that made me happy. But hopefully in December, that's when I see him again, December 13th. And that he thinks I'm doing a lot better than I was before, and I asked him about, as far as the concern that keeps repeating over and over in my mind about the increased appetite the medications cause, and though I know I could use some pounds, I'm just scared of going over my ideal weight when I'm supposed to be, which I don't think I'm at my ideal weight yet. But I had concerns. He said just stay away from fried foods and greasy foods, oily foods, and sweets and stuff, things like that. And then my case manager said she'd help me with that, not to worry, My husband says it's something I worry about a lot, and I do. Because it's like me and people in my family, sometimes they talk about it, and then I start thinking about it. And it's always something I've heard since I was young, and it's self-conscious about maybe that happening to me. And then the medication side effects and stuff, it concerns me. So I just want to be able to be healthy weight, and stay at a healthy weight, and find a dietitian and be able to eat better, eat healthier, and things like that. And so yesterday I went and got my hair trimmed, which come to find out I'm supposed to wait up for 3 months. But I got my hair shampooed, trimmed, and I got some frizz control stuff, which I may share in my next video. I'll have it on hand because I had to return it or go up there, because I think it kind of ripped me off, because he said $9 for a haircut and a shampoo and a trim. And I don't know why it racked up to $14, neither does my husband. So I'm supposed to take care of that. Before that, we had a late lunch at Fritz's restaurant, and way before that I went to Walmart to find a little ashtray for my Crocs. I'm trying to clean it since my husband's been driving the Cavalier that he's making payments, trying to improve his credit supposedly, and trade it in 4 months. What else? Day before that, my best friend that I went to school with since I can remember, took me went to his place, or went to get his check cashed, and then after that, went and got his doggy some food, He's a boxer, and I forgot what else, but he calls him Hooch. And we went and fed him, and then after that, went and cleaned out my car, the vacuum. The vacuum's kind of stuck at that one location by the car wash. Maybe try to clean my windows, inside the windows of my car today. Thought just popped in my head. Maybe Armorall my car, wash it with soap, I guess, and then Armorall it. I never really cleaned the inside of my car really well. I think it needed shampooing and stuff, and things like that. Yesterday was okay. After all that running around, my husband surprised me with a little lighter outlet for your cell phone charger and some sweets with sign like I don't think I'm supposed to be having those. And then I guess he got Hannah a couple things too, like a little special calendar, and then later I showed Sam, my friend, how to paint by numbers. Got him horse painting, paint by numbers, and things like that. I think I'm going to have to stop this video and make a part 2 here in a little bit. So I love you all, and keep watch for part 2 of my video diary, I think 7.